Fordyce spots or granules are small, raised, pale red or white bumps that may appear on the labia, scrotum, shaft of the penis, or on the border of your lips. Essentially they are visible sebaceous glands, which normally secrete oils for the hair and skin. One may commonly appear during puberty and are harmless. They are not infectious and not considered an STD, sexually transmitted disease like herpes and genital warts are. No treatment is typically required, although getting rid of them for cosmetic reasons is common. Laser and other surgical treatments are the most effective medical treatments. Getting rid of Fordyce spots. Consult with a dermatologist. If you notice little bumps on your genitals or around the borders of your lips that aren't going away or are bothering you, get a referral from your family doctor to a dermatologist, or skin specialists. The dermatologist will be able to diagnose your condition and put your mind at ease, because Fordyce spots can sometimes look like small warts or the initial stages of a herpes outbreak. Fordyce spots are a very common phenomenon and appear in about 85% of the population at some time in their lives. Males are a little more likely to develop them than females are. It's important to realize that Fordyce spots are harmless, painless, not infectious and do not require treatment. Their removal should be for cosmetic reasons only. Fordyce spots are much more noticeable when the skin is stretched, and may only be seen during an erection in males or during pubic hair management bikini wax for females. 2. Ask about the available laser treatments. If you decide to remove some Fordyce spots for cosmetic reasons, talk to your dermatologist about available laser treatments, which are the most common method of getting rid of them and certain other skin conditions. 3. Vaporize. 2. Ask about the available laser treatments. If you decide to remove some Fordyce spots for cosmetic reasons, talk to your dermatologist about available laser treatments, which are the most common method of getting rid of them and certain other skin conditions. 3. Vaporizing laser treatments, such as carbon dioxide CO2 lasers, have been used with some success on Fordyce spots, but so have pulsed dye lasers. Ask your doctor which may be most appropriate for your condition and budget. CO2 lasers were the earliest gas lasers developed and remains the highest power continuous wave laser treatment currently available for various skin conditions. However, CO2 laser ablation can leave scars afterwards, so it may not be appropriate for Fordyce spots on the face. In contrast, treatment with pulsed dye lasers is more expensive than CO2 lasers, but may be less likely to leave scars. 3. Consider micropunch treatments instead. Micropunch surgery is a procedure that involves using a pen-like device to punch a small hole in the skin and remove tissue. It's often used in hair transplant surgery, but research indicates it can be very effective for removing Fordyce spots also, especially on the genitalia. For the risk of scarring with micropunch surgery is less than CO2 lasers and the spots don't seem to return, which is a possibility with CO2 and pulsed dye laser treatments. The local anesthetic is needed to eliminate the pain of micropunch surgery. The tissue removed with micropunch techniques is not destroyed unlike laser therapies, so it can be looked at under a microscope to rule out other more serious skin conditions, such as warts or cancer. Micropunch treatments are generally very quick and can remove dozens of Fordyce spots within minutes, making it ideal for people who have hundreds of spots on their genitalia or face. 4. Think about using topical prescription creams. There's some evidence to suggest that hormonal imbalance triggered by puberty, pregnancy and menopause can cause or contribute to Fordyce spots in the same way they can contribute to acne pimples. As such, the variety of prescription creams that are normally used on acne and other skin blemishes can sometimes yield results on Fordyce spots. Ask your dermatologist about the potential for using topical glucocorticoids, retinoids, clindamycin, pimecrolimus or benzoyl peroxide. Clindamycin cream is especially helpful for combating inflamed sebaceous glands, although it's rare for Fordyce spots to become swollen. For younger women, going on oral contraceptives may reduce or eliminate Fordyce spots, much like how they impact acne. CO2 laser ablation is often combined with the use of topical exfoliating acids, such as trichloroacetic and bichloroacetic acids. 5. Ask about photodynamic therapy. Photodynamic therapy is a light-activated treatment. The medication called 5-aminolabulinic acid is applied to the skin, allowed to penetrate, and then is activated with a light source, such as a blue light or pulsed dye laser. This treatment can also treat and prevent certain skin cancers and acne. Be aware that this treatment can be expensive. This treatment also makes the skin more sensitive to the sun temporarily. Do you want to get rid of really? Then click in the description below to get the awesome solution for you. Don't forget to subscribe our channel for future videos.